returning to us. We are going to continue our session, Biomimetic Research Talk, with the second segment right now. And this second segment will include three speakers that I will now introduce to you. It is called Restoration of Broken Down Endodontically Treated Teeth. And we will have Dr. Carvalho, Lazari Carvalho, talking about no ferrule, no post approaches. It is an absolutely hot topic, and I'm so excited about that. So here's our first speaker here, Dr. Adriana Carvalho. Adriana is going to talk about no ferrule buildup in posterior teeth. Excuse me for a second here. Voila. And Adriana lives in Salvador Bahia in Brazil. She's a professor at the State University of Feira de Santana and Baiana School of Medicine and Public Health. And she graduated from the State University of Feira de Santana in 2004. Adriana, please go ahead and share your screen with us.
Hi everyone. As Dr. Moe mentioned, I am Adriana Carvalho. We worked together at USC from September 2011 to October 2012. And it's a pleasure to be here today to talk about the influence of no ferrule and no post build-up design on the fatigue resistance of endodontically treated molars restored with CAD/CAM crowns. This study was part of my doctoral thesis that I present at Unicamp São Paulo in January 2013. My mentor in Brazil was Dr. Marcelo Giannini, and my mentor in the US was Dr. Pascal Mounier. So, deciding how to rehabilitate endodontically treated molars with extensive loss of corneal structure is a challenge in restorative dentistry. These teeth are considered to have a higher risk of fracture than vital teeth because of their inherently poor structural integrity, with loss of root and coronal dentin, resulting from pre-existing caries in or tooth preparation. No? Although earlier publications have called for stabilization of endodontically treated molars with intracranial post and ferrule, other evidence has demonstrated that post reinforcement is not beneficial. Even though posts are frequently used to retain coronal buildup materials, they do not reinforce roots, and they may even weaken them through loss of radicular dentin, necessitated by post-space preparation. In addition, preparing a post-space is extremely difficult, and it's a quite delicate procedure. It also carries a high risk of root perforation. The loss of tooth structure during preparation affects tooth stiffness, reduces its resistance to fracture, and result in treatment failure. Other studies have evaluated the fracture strength of endodontically treated molars with extensive loss restored use endocrown and the conventional technique that is, you can see glass fiber post and ceramic crown. They have confirmed that endodontically treated molars restored without endocrown restoration have greater fracture resistance compared to those restored using post, which suggests that posts are not required. Posts are not necessary. Lima and others evaluated in this study the effects of ferro preparation on the fracture resistance of endodontically treated teeth restored with composite resin core with glass fiber posts and or composite resin cores without glass fiber posts. We can see here in this slide that the groups on the top had a ferro preparation, and the group at the bottom did not have a ferro preparation. The presence of a ferro preparation was shown to increase the fracture resistance of endodontically treated teeth with composite core and crown, regardless of whether or not a glass fiber post was placed. The use of a glass fiber post associated with a composite core showed no significant influence on the fracture resistance of endodontically treated teeth, regardless of the presence of a ferro preparation. So they confirmed that the presence of a ferro is more critical than the use of a post. We know that composite resin has properties similar to that of the natural tooth tissue, and today advanced adhesive procedures are allowing clinicians to save and stabilize valuable tooth structure through bonded composite resin buildups. Therefore, we developed the idea to make a ferrule using only composite resin on the endodontically treated molars with extensive loss of coronal structure. However, there is no consensus about the optimal build-up design necessary to restore these teeth in the absence of any ferrule. There was a lack of data about the biomechanical behavior of different build-up design to restore these teeth. Besides that, we didn't know the performance of crown made of nanoceramic resin, lava ultimate that we used, and lithium disilicate on this different build-up design. So we completed 2 different studies that we published at Operative Dentistry. They evaluating the influence of no ferrule and no post build-up design on the fatigue resistance of endodontically treated molars. In the first study, we evaluated restorations made of nanoceramic resin, there was lava ultimate from 3M. And in the second study, we evaluated restoration made of lithium disilicate, there was an MX from Ivoclar. Study 1 and study 2 had the same 3 groups. In group A, the specimens had 4 millimeter buildup. In group B, the specimens had 2 millimeter buildup. One consideration was the possible use of a core buildup to remove retention from the endodontic preparation, provide some kind of positive geometry, decrease restoration thickness, and facilitate provisionalization. And in group C, the specimens had no buildup. They were restored using endocrine restoration. The endocrine restoration is an alternative restorative treatment for endodontically treated molars. This type of restoration preserves root tissue and limits internal preparation of the pulp chamber to its anatomic shape. It constructs both the crown and core buildup as a single unit. Study 1 found that the build-up design had no influence on the performance of endodontically treated molars restored with nanoceramic resin. All restoration designs survived the normal range of masticatory forces, and failure modes tended to be more favorable with the 2 millimeter buildup or no buildup. Study 2 found that the build-up design influenced the performance of endodontically treated molars restored with lithium disilicate CAD-CAM complete crowns, and the 2 mm build-ups were associated with higher loads to failure than the no build-up in 4 mm build-up. But all restoration designs survived far beyond the normal range of mastigatory forces. From a clinical perspective, the endocrown designs seems to have practical advantages over restoration with a core build-up. It is cheaper, it takes less time to complete, and there is less composite resin shrinkage associated with this technique. The endocrown is also a useful option when there is simply no occlusal clearance. I mean, extra short clinical crown. On the other hand, there are advantages in using an adhesive composite resin core build-up when possible. The build-up is preceded by the use of a dentin adhesive system that safely seals the dentin. It reduces the thickness of the overlay restoration, allowing for a more efficient light polymerization during cementation. Small composite resin build-up are preferable, and they also induce less polymerization shrinkage than larger ones, and they are useful for providing enhanced geometry, removing undercuts from the endodontic preparation, facilitating the provisionalization, I mean stabilization when necessary. In summary, we can conclude that the endocrown restoration is the least complicated way to restore endodontically treated molars without ferrule. And when we need to make a provisional, the 2 mm core build-up is the best way. I would like to emphasize that crown indication for lava ultimate, I mean nanoceramic resin, is no longer supported by 3M, and that other CAD/CAM materials should be considered for this indication. This study was supported by CNPq and CAPES, so I would like to express my sincere gratitude to both. I would like to thank Dr. Moyer in the USC, Dr. Janine in Unicamp. I was so blessed to have you both as mentor. Thank you.
Thank you so much, Adriana. Absolutely beautiful job. I mean, I cannot imagine how many, yes, I can imagine running all the specimens for your studies, and it's great, and I totally support your conclusions. I think it's an eye opener on social. Some people say biomimetic restorations are not social economic. Yes, they can be endocrowns and short buildups and more efficient, less posts, more bonding, right? Less posts, more bonding. So, Adriana, thank you for those amazing conclusions on the posterior dentition. Really great job, beautiful photography. And let me introduce our next speakers now. So here they are. I'm going to introduce to you Dr. Here we are, Dr. Priscilla Lazari. Oh, sorry. Here we are. I'm going to introduce to you our next speakers, Dr. Priscilla Lazari and Dr. Marco Carvalho, who are about no post crowns approach, no post crowns approach for endodontically treated anterior teeth. She's actually Marco's wife. Congratulations, they just got married. And she works at the University of Annapolis, Uni Evangelica. She completed her DDS at UNESP and her MSc at Unicamp in 2012-2017. And she was a visiting scholar in my lab in 2015. So Let's start with you, Priscilla, and go ahead and share your screen with us. Fantastic. Here you are.
Hello. Hello.
Yes,
Yeah.
Priscilla, we can
Okay.
hear you, and
Yeah.
let me, voila.
So first of all, I want to thank you, Pascal, for the opportunity. It's amazing to be among our research team, and was amazing to be with you at the USC in 2015. And I also want to acknowledge the CAPES Foundation in Brazil for the scholarship. Because of this scholarship, we were able to be at the USC back in 2015. So today, I will talk about the Farrell effect and the use of posts for endodontically treated incisors. And I remember when we were talking about this topic and about our future project, and Pascal proposed to us the study about the endodontically treated incisors. And we started searching the literature about the topic and didn't find a consensus about how to treat a endodontically treated incisors. So we started our project on how to restore them using the biomimetic approach. So we published these two papers here. Oh, I'm having, okay, so here are the study that we published together. One of them is published in the Operative Dentistry Journal, and the other one in the Journal of Prosthetic Dentistry. So I will start with this one, the first one, about the Farrell effect and the Farrell effect on the incisors. So the problem is the endodontically treated incisors in the challenge scenario. So those teeth are considered to have a higher risk of fracture than vital teeth because of their poor structural integrity, with loss of root and coronal denting resulting from pre-existing caries or tooth preparation. So nowadays we have to choose two choices to use: the resistance and retention form of the cast metal post and core, or the adhesion path using the prefabricated posts. It's been proven by literature that metal posts elastic model could even increase the risk of root fracture. Then a more biomimetic material was introduced to better copy the elastic model of the denting, the glass fiber post. The use of glass fiber posts has been associated to a lower incidence of root fracture. So the decision of how to rehabilitate endodontically treated incisors with extensive loss of coronal structure is a challenge for restorative dentistry. What we know is that the Farrell effect is a general agreement. So the Farrell is the most important mechanical factor for the strength of endodontically treated incisors. So the presence of adequate Farrell decreases the impact of the post and core systems, the luting agents, and the final restoration on the performance of endodontically treated teeth. Also, teeth with Farrell have a tendency to fail in a more favorable mode. So if the Farrell is too important, why we are still using posts in this kind of teeth? It's not new, the information that intercanal retainers don't reinforce the root, but only promote retention of the restoration, associated with the fact that the preparation of the root canal for the post weakens the root. So we started to search in the literature new ways to restoring those broken down incisors with a more biomimetic approach. So our question is, with the improvement of adhesive dentistry, is a post necessary to retain a ceramic crown when the teeth has Farrell in endodontically treated incisors. So the objective of this first study was to investigate the restoration of endodontically treated incisors with 2 millimeters ferrule with and without fiber pulse. And we use a non-ferrule group with fiber pulse also to comparison. So here we have our 3 groups from this first study. 2 of the groups with 2 millimeters ferrule and 1 of them with no ferrule. So the 2 millimeters groups, 1 of them received a glass fiber pulse, and another one was restored without pulses. So the roots were prepared to receive a fiber pulse or to receive a colored internal ferrule. That was a preparation inside the root to receive the core buildup. So the posts were cemented with dual cure resin cement, and then in this internal preparation, we applied the adhesive system and build the core with a regular composite resin. After then, the samples were prepared to receive a full crown that was designed and manufactured using Cerex system. And here is the size of all crowns that were milled using lithium desilicated blocks. So for the cementation, we use the resin cement, the Varilink static dual cure. And here we have the pictures of our final samples. So all the samples were submitted to investigatory forces simulated in an electrodynamic machine, and all the tests were monitored using a macro video camera and recorded continuously in order to determine the crack propagation mode, the initial gap, the root fracture, and the final fracture. As a result, we evaluated the fatigue resistance, load to failure, and failure mode of each specimen. And we can see here how the specimens were analyzed about the failure mode in repairable, possible repairable, and catastrophic failures. The results of this study, we can see that the groups without fail present the initial failure. Here we have a movie. I don't know if you can see the movie quickly, but this movie you can find in our publication, in the JPG publication. So all the groups without fail present the initial failure. The groups that, here we have our all our results. So the 3 groups, the group with fail had significantly higher survival rate compared to the no fail group. So fail was the factor, the most important factor in the survival of the groups. And we didn't have difference between the fail groups with pulse or without pulse. So the only difference was the groups without fail. But a further problem with the fiber pulse was revealed with the higher rate of catastrophic failure. So I will show you guys a movie, and in this movie we can comparing the post groups and the no post groups, both with fail. So let's see the movie. So the clear fracture of the no post groups may allow the dentin to repair the restoration as soon as it fails. So the percentage of failures, here we can see the failure mode. Groups with fiber pulse showed 100% of catastrophic failures, while the no pulse group presented 15% of non-catastrophic failures. So the conclusion of this study is that insertion of a glass fiber pulse does not enhance the survival of all ceramic crowns. In the presence of a glass fiber pulse, catastrophic failure of the specimens was often preceded by a cyclic opening of a wide gap between the crown and the root. and the least amount of catastrophic failures was found with direct core buildups without post. And the absence of a ferrule was not compensated by the use of a glass fiber post. So this study leads us to our second one. From the previous study, we knew that the ferrule is crucial for the optimal biomechanical behavior of the endodontically treated incisors. However, endodontically treated incisors do not always offer enough tooth structure to generate a ferrule. So we need to investigate other elements as the use of post and core foundation restoration material itself that could compensate for the absence of ferrule. So the question of our second study is how to restore the no ferrule incisors. Which post and core combination will best improve the performance of extensively damaged endodontically treated incisors without ferrule? So here we have the elastic modulus of cast post and core and the prefabricated posts. So the cast post and core have a very different elastic modulus compared to dentin. And we are trying to use a more biomimetic restoration and using materials that have the same elastic modulus to dentin. Core foundations restorations must have favorable physical properties to facilitate their resistance to mastigatory forces and to enhance performance of the crowns. Composite resins are commonly used as material core foundation restoration, and more recently, bulk fill composite resins have been introduced. And another alternative is the 2-in-1 material that is used to cement the post and build the core with the same dual polymerized material. So in this study, we want to find the better combination between prefabricated posts and different core buildups. So the purpose of this in vitro study was to investigate the restoration of extensively damaged endodontically treated incisors without ferrule using glass ceramic crowns bonded to 3 types of composite resin core and 2 types of posts. So here we have our 6 groups. One of the groups was with ferrule, just for comparison from the previous study, and 5 of them without ferrule. And we use 3 materials to do the buildup. One is with regular composite, another one with bulk fill composite resin, and another one with dual polymerized composite resin. So all these samples receive the same preparation and the same treatment as the previous study. And then as we knew about the initial failure, we evaluated these samples before failure, with initial failure, and with final failure. Now I will show you another movie with the before, initial, and final failure. Here we can see the final failure and the wide gap opening between the crown and root, and the final failure. So all the samples, they were evaluated using the initial and final failure. As a result of this study, just wait 1 minute. Yes, okay. So all the samples in this study present the initial failure because all of them receive a post inside the root canal. This initial failure, that is a wide gap between the crown and the root, this occurs because of the elastic modulus, the elastic behavior of the post, that may be a disadvantage because the cyclic bending between the crown and the core and can induce micro cracks in the core and in the resin cement, leading to the failure of the restoration. Here we have one more movie about this initial failure that leads to the final failure of the restoration. So in this study, we learned about this initial failure in the adhesive crowns using glass fiber posts. And these initial failures was the first sign of a failure in a post and core restored tooth. The restoration that has experienced initial failures could persist in place, apparently intact for some time, but we can have a bacterial infiltration causing secondary decay and jeopardize the integrity of the root canal still. So once this initial failure progressing, this will lead to the fracture of the tooth. But the problem is your patient, they can probably don't see this initial failure. So they will keep using this restoration. And when you saw the failure is too late and you lose the teeth. So here we have the results of this study. You can see the life table survival, and we can see a very different line. This very different line is the feral groups. So we have the significantly higher survival rate for the group with feral, and the only group that present a different result was the group with glass fiber post and bulk fill composite resin. Foundation restoration was significantly higher than in the group with titanium post. But the problem is, in this study, we found 100% of catastrophic failures because all the samples have intracanal posts. So all the samples presented glass fiber posts or titanium posts. So all of them present a 100% catastrophic failures. So the conclusion of this second study was that the use of posts was not sufficient to compensate for the absence of feral, because we had a difference between the feral and the non-feral groups. The failure of the non-feral specimens were always preceded by the cycling opening of a wide gap at the lingual margin that we call as initial failure, and the presence of the post always negatively affect the failure mode. So we have the general conclusion about our two studies is that the survival of the broken down non-vital incisors was improved by the presence of the feral, but not by the presence of the post. So the feral is the most important factor in this kind of teeth. So we need to preserve them. And the posts were always detrimental to the failure mode and were not able to compensate for the absence of the feral. So just to finish my presentation, I want to say thanks again to the CAPS Foundation and to my university in Brazil, Unicamp, in name of my supervisor in Brazil, Professora Altair Antoninha Del Belcuri, and say thanks to Pascal, Dr. Pascal Mani, and the Herman Ostro School of Dentistry for receiving us for this time, and all these companies for giving to us the materials to do this research. And I want to finish with a phrase from Pascal that is in a British Dental Journal. And we always say this phrase, Pascal, so it should not be about aesthetics, but tooth conserving dentistry. So thank you so much.
Thank you, Priscilla. Wow. Wow, wow, wow. It is absolutely amazing. I mean, guys, you really have to stay tuned. Beautiful work, Priscilla. I mean, you have to know Priscilla and Marco Carvalho worked as a team. They generated a absolutely huge amount of data, and Marco is going to keep going now, and he's going to share with us the next part of research. So now we know about loss and the effect that posts cannot compensate for the absence of ferrule. So what is the best no post restoration? And that is what Dr. Carvalho is going to share. So Marco is also in Guyana, Brazil. His workplace is the University of Anápolis, also together with Priscilla Unievangelica, and he's also a private practitioner in Guyana, of course, and his dad is also a dentist. That's amazing. And his education, the DDS was as UFG, and MSc and PhD at Unicamp 2012-2017. He was a visiting scholar in my lab in 2015. Marco and Priscilla, you are amazing. I'm so proud of you. I want to take advantage here to thank Marco, because Marco is also coordinating a little bit the technology part of this presentation. Thank you, Marco. The screen and the microphone is yours.
Great. So guys, thank you very much for having me here and stay with us. Pascal already introduced us, but I'm just going to keep going on in the same study that Priscilla just presented to you. Right now, what I'm going to do is I'm going to explore a little bit more the no-post approach for those broken down incisors. Okay, so these are in vitro studies that we are constructing evidence from the bottom to the top on how to better restore those teeth, okay? First of all, thanks everybody for being here, and Pascal for inviting us, for putting this together. Just every time I start with these, I have to make this disclosure, and I have no conflict of interest with any company that's gonna be presented here, but we are thankful for all the companies that supported us by donating their material, okay? So everything we're gonna show to you guys here is pure science without conflict of interest. Pascal already introduced me, but pretty much I'm a dentist here in private practice, and also a teacher, a faculty at university, okay? Guys, I'm just gonna complement a little bit what Priscilla and Adriana already told to us on these endodontic treated teeth, how to restore those non-vital teeth. I wanna start with the death spiral. You can see the death spiral on that Fraser-Scott book on cariology, and he talks about that on chapter 23. The death spiral is really interesting because what's about the death spiral? Everything started with a decay, a small one, right? So we make a small restoration, and then we have a secondary decay, margin infiltration. Then we make a larger restoration, okay? And we may end up with vitality loss. And when we made up with vitality loss, we usually, traditionally, what we do is endodontic treatment and post and core. That's traditional dentistry, right? That's millions of teeth were subject to that kind of restoration. When you place a post on that root to retain the crown, if anything fails, usually it's gonna be the root. And if the root fails, now we end up losing the root, and we have to extract the tooth and place an implant. For many years, a lot of people think that, okay, implant is the end of the death spiral, right? Okay, I removed the tooth already, so there's nothing else wrong to happen. But actually, now after decades of implants in people's mouth, we understand that there's another problem, a new one, periimplantitis, right? So that cycle, that spiral, actually, we can be called as a cycle too. It's endless, okay? So we are working here, we're presenting here on that part, how to avoid root fracture. So I want you guys to bear with me and follow me on this, in this idea of how to avoid root fracture. Because if I avoid or postpone root fracture, I'm less likely to go to implant and periimplantitis and that endless cycles, okay? So how to restore those teeth? I'm not gonna go over an introduction to show you what we have in the literature. We don't have a lot of time to explore that, but there's a lot of evidence in the literature. If you go on PubMed and search for it, you're gonna see thousands of studies on posts, type of post, type of ferrule. We don't have much on, we don't have many studies about the use of no post when performing a adhesive approach. When I talk about adhesive approach, I'm talking about ceramic or composite restorations bonded to those teeth. We have some excellent clinical trials showing that if you use porcelain fused to metal, if you don't use a post, it might be a problem, but that's not the adhesive restorations we are talking right now, okay? So Priscilla and I, we went to Pascal's lab in Los Angeles at the USC in 2015, and together with Professor Altair Curi, who's our mentor in Brazil, and Pascal Mani, our mentor in the US, we developed some studies. Priscilla already presented to you those two, okay? But besides those two, we still have other studies going on with an all-post approach, okay? Priscilla told to us already that the more tooth structure you lose, the more likely you are to have a failure. That makes a lot of sense. I don't have enough remaining structure to withstand the mastication, right? The occlusal force. And when those failure happens, that's the problem, guys. Extremely destroyed, extremely damaged, broken down, non-vital tooth, when something goes bad, usually is the root that fracture. And that's our main goal now, is to how can we do a restoration that's not gonna be stronger than their underlying tooth structure, okay? That's the biomimetic approach. If I do something strong enough that when it fails, it's gonna be the root, I'm not going on the biomimetic approach, right? So restoring those teeth might be a challenge, okay? Tooth like these with ferrule, okay, I can choose either going for resistant alimentation form or adhesion. Priscilla told you already about that. But when I have ferrule, I still have a lot of things to hold on macromechanical retention, right? But in cases like this, where I don't have ferrule at all, I have root decay, or I have an old post and core that failed but did not fracture the root, what's really rare. In a case like this, what to do? If you guys see in the screen, that clamp, it's a B4, Brinker B4, okay? So imagine the thickness of dentin is less than 1 millimeter thick. What I'm gonna do with that tooth? I'm gonna extract it. I'm just gonna lose it. Go for implant. I'm gonna place a post, or what about a postless build-up? Or even an endocrown? So the idea here is to have something restorable, but whenever it fails, we have to try to save the root, okay? So that's the approach you're gonna be exploring here. So that's the initial scenario. When you have caries detector and remove the caries, that's what you got. So what we did in this research, we tried to use that kind of scenario, that clinical scenario, and make those groups. Priscilla showed to you guys some groups of the study. I'm gonna be summarizing here everything. So we have 12 groups at the whole study. The first study factor is the ferrule. So Priscilla sent to you already, showed to you 2 millimeter ferrule or no ferrule at all. I'm gonna be focusing on the no ferrule teeth, okay? The other study factor is the retention. We have post, we have no post, and we have endocrown, which is a no post but with monolithic restoration, okay? And we also have the post type. What kind of post are we using, the fiber or titanium? So Priscilla showed you guys already that too. And we also have the endocrown material. So I'm gonna do an endocrown made of composite, or I'm gonna do an endocrown made of ceramic. So that's something we tested too. And now, so what the type of build-up I'm using? I'm using a regular composite build-up. I'm using a bulk fill composite. Is it better or worse? Or I'm using a new fiber reinforced, a short fiber reinforced composite, okay? So when you put everything of that together, that's what we have. Those are the 12 groups we have for the whole study. Priscilla presented some of it. I'm gonna present another part of it, okay? So you see, guys, in the green part, the groups with ferrule, okay? I'm not gonna be focusing on that. Priscilla showed us already that if you have ferrule, you don't need post, and if you have ferrule, even without a post, is better than any other group you can imagine. Okay, so feral is a mandatory, I mean, it's the most important part of it. Okay, and on the yellow part here, in the yellow section that you see in the bottom, those are no feral groups. So you see that we have a lot of those because you want to test more of that. Okay, and the ones in the right corner, it's everything without post. Everything without post. So we have 3 groups without post, but with a build-up material made of regular composite, the red one, the blue one, regular composite, the red one is bulk fill composite, the green one is the fiber reinforced composite, and we have the 2 endocrowns made of ceramic or composite, okay? So I'm not gonna go over the methodology. Priscilla showed us already how to do it. I'm just gonna focus on some special part here because I want you guys to pay a lot of attention to that. That makes a lot of difference, which are the immediate dentist sealing. Okay, everything we're doing here, we are doing according to the biomimetic principle. The biomimetic principle supported by adhesion. So we want to have the best adhesion possible, especially because we're talking about indirect restoration. So IDS on everything. So I want to make sure you guys understand that. And we used CAD/CAM to provide those restoration in order to make them more standard, either the crowns or the endo crowns. Okay, so everything we did was in CAD/CAM to make all the samples as close as possible. The bonding performance, the bonding protocol we used was according to the manufacturers, either for lithium silicate or resin composite CAD/CAM blocks. And we also did the same thing on the tooth with sandblasting and using the proper adhesive system or luting material, okay? After bonding those restorations, we went for the chewing simulation, which is the fatigue test, the accelerated fatigue test. So you guys can see on the screen, Pascal's lab. So we work there with CAD/CAM, we work there providing the samples and also making all the simulations. So guys, the only thing I want to talk to you about the accelerated fatigue test is that there is a huge difference between the single load to failure, which is the most common test used. You apply a single force until it breaks, to the accelerated fatigue test. So the accelerated fatigue test, what we do is we increase the amount of load as we increase the amount of cycles. Okay, so that's more similar to what we do in our mouth. We don't bite until it breaks. We fatigue those teeth until they break. So that's pretty much what we're doing here. The external validity of those studies is better than single load to failure, but just want to make sure guys understand that all the studies that are going to be presenting here, we're going to use accelerated fatigue test. So that's pretty much the test that Pascal's love to do. And it's really interesting because the results are closer to the clinical scenario, okay? So let's go to the results, go straight to it. Out of all those groups, I'm gonna focus on the groups without post, okay? So when you have compared the post and no post groups without feral, okay, when you compare them, what we saw on those Kaplan-Meier curves is that everything is messed up. Everything is like close to each other. So we don't have much difference, okay? But if you see on the graph on the right, we have those 2 first groups, which are A, you see little A's. Those 2, they were better than the other ones. And those 2, they were the groups with post. But Priscilla showed to us that those results, they are biased. Why? Because when we saw during our pilot test, so as you can see, that's what we saw during the pilot test. So during the pilot test, we saw that there was a failure. I could hear it. But for some reason, the machine could not understand that as a failure. So what we had to do is we had to record everything and try to see when those failures happen and calculate the amount of force and the cycle that happened. When we do that, everything changed. So here in the screen, we have the summary of the before failure, initial failure, and final failure, as Priscilla Lazare explained to you. But when we are using a no post approach, it was really different. So check this video out. So what you guys saw here right now in the left corner is no ferrule with post, okay? So the initial failure happened, it opens a gap, the root is broken, there is infiltration on your patient, there's bacteria, there's bone loss. We don't want that. But those in vitro tests, even though we are using the highest end machine for testing that, because of the bending, it cannot predict as a failure. So we have to manually calculate that. But when you have a no post approach, most of those failures, when they happen, they go either for the restoration fracture without breaking the tooth, or it breaks a piece of the tooth because it's so well bonded, right? And remove a piece of the tooth, of the root, without going under the bone. So we can make that, we call that possibly repair, because I didn't lose the root. I still can redo the restoration, okay? So what's the clinical implication of those initial failures? As you can see here on the left corner on this CT scan, this tomography, CBCT scan here, you can't see there, but I'm gonna tell you, there is on the buccal plate here of the root, there is a fracture, okay? But I still have the buccal plate of the bone. But with time, what happens is, this is another case, but just more evolved, with time we lose that buccal plate. So for those that make implant, they place implant, they know that that's the worst case scenario. You don't have a bone buccal plate. Then you have to deal with that. So when you have those initial failures that the patient can feel pain, the tooth is already attached, the crown is already still attached to the root, that's a problem. And that's why we see on CBCT, that was a CBCT sent to me by my friend Mike Bueno. So you have like a hole because you lose the bone. So that's the clinical implication of initial failure. We don't want the initial failure to happen. We lose bone. And I mean, it's less predictable, the restoration, even the implant restoration, okay? So since we know it's biased, so when we make the comparison with final failure, and that what happens, everything here is the same, okay? So if I'm doing with post and without post, it's the same, okay? It's the same. But when I use fiber reinforced composite resin, I have better result. As you can see here, I have better result with fiber reinforced composite resin. But that's only for the amount of cycles of survival. But when I come and see the failure mode, what you see in red is catastrophic failure. And when we place a post, 100% of the failures were catastrophic, okay? But when we don't place a post, we still have the chance to repair those teeth. I'm gonna just show you the pool data with the endocrown so that you can understand. So we make those groups together and we pull that data, and I make those Kaplan-Meier curves. And the black curve that you see there that goes longer and I have better survival, those are all, we are comparing ferrule and no ferrule, post and no post, okay? So all the 12 groups. The black curve you see is with ferrule. So if I have a ferrule, if it outperform everything. But the second curve that you see there, it's a light blue, that's endocrowns. So those endocrowns, they outperform everything else when we don't have a post. So that's why we're so focused on the endocrown restoration. We want to try to use that more often. And if I'm not using endocrown, the no post was better than the post, okay? Outperform the post restoration. So this is the failure mode. I'm just gonna finish with this for you guys. The conclusions is that the survival of broken down non-vital incisors were improved by the presence of the ferrule. Priscilla showed you that, but not by the presence of the post. Posts were always detrimental to the failure mode, 100% of catastrophic failure. but we don't place a pulse, we have better failure mode stop, okay? The earlier results of this no-pulse approach encourage it used as an alternative to restore those teeth following the biomimetic approach. So the thing is, I don't want to have the weak link in the root. I want to have the weak link on the restoration. The biomimetic restoration, it has to fail slightly before the underlying tooth structure. So guys, this is what I have to show to you. I mean, we only have 15 minutes to show everything, but whenever you want to decide what path to go, consider this. When I have a fragile, a broken down tooth, I have to take in consideration the area for adhesion and the volume to decide. If I have a lot of area for adhesion, I have the micro retention. If I have the volume for my pulseless buildup, that pulseless buildup, you have a withstanding cohesive strength, okay? So I don't need pulse because of that. If I have a really strong buildup, that's not gonna fail every time, I don't need a pulse. So pretty much that's what we are showing to you guys. I want to be I'm thankful for all the people that help us on those studies, the companies that donated everything to us, for the Brazilian people for the support on CAPES, and also to the universities that are among. We're still going on in more studies. This is not finished. And I want to end up thanking. I'm so thankful, Pascal, for having this opportunity. And that's it, guys. Hope you guys are enjoying this. Pascal, you have the word. And thank you so much for putting this together.
Here with Priscilla, I'm so proud of you guys. The best part is that you got married to me. So now we are waiting for the next step, guys. And congratulations. I mean, groundbreaking research. I hope you got the message there. This is in vitro. I want to close this session soon because we are running out of time for the Instagram session. However, I want to say what is amazing in all the work we've seen and we are going to see is the ultimate level of standardization. You know, you cannot standardize research very much when you do clinical research because of the limitations, the operator limitations, the patient limitations, the ethical limitations. But in those studies you have seen so far, and you are going to see in the next presentations, the level of standardization is at its most because all the preparations are standardized, all the restorations are standardized by the CAD/CAM approach. So we reach a level of standardization that makes this in vitro simulated research super significant. And I think what we've seen is absolutely amazing. I'm so proud of you. At this time, I'm going to say thank you again to our first round of speakers here. Let me show them again here real quick. So we had Dr. Adriana Carvalho, Dr. Lazari, Dr. Marco Carvalho. Thank you so much. You've been wonderful. And when we return, please don't leave. We will close the session. But when we return, we are going to look at possible concepts for more biomimetic implant restoration. We have 6 speakers about the topic. Here they are. So stay tuned. We will be back in a second. Thank you very much.